Hi, my name is Elizabeth Vargas, and I will be presenting on tuberculosis in Hispanics or Latinos. I am a student in Health 35002D, and I hope you enjoy. Thank you. According to Lang and contributors, tuberculosis takes approximately 2 million lives per year. According to the CDC, tuberculosis can develop weeks or even years after the exposure. Latent tuberculosis is when a person has tuberculosis in their body, but it is not reactive. Vaccines are used to prevent tuberculosis, and latent treatment of tuberculosis is as important as preventative treatment through vaccination. Prevention includes education and immunization, which reduce incidence, and the tuberculin skin test is the only way to identify tuberculosis infection. For the CDC, tuberculosis is treatable. However, it can become drug resistant, can cause death if it's not treated on time, becomes a health burden on the individual affected, and becomes a financial burden. The estimated cost is between $18,000 to $494,000 per individual. According to Walter, risk factors include immigration from an area of high risk. For this reason, immigrants are disproportionately affected, specifically Hispanics or Latinos. According to the CDC, tuberculosis is an infectious disease caused by the bacteria Mycobacterium tuberculosis. The CDC website states that tuberculosis occurs due to either direct exposure or latent exposure. Per Lang and contributors, tuberculosis is one of the leading causes of death worldwide, taking approximately 2 million lives per year. It is a communicable disease, which means it can go from person to person, and it attacks the lungs but can attack other body parts as well. Campbell and contributors indicate that immigration from low-income countries reversed the decline of tuberculosis rates in high-income countries. The highest incidence of tuberculosis occurs within immigrants and happens within the first 5 years of migration. It can still develop after migration. High incidence of tuberculosis among immigrants from low-income countries calls for a need to reform TB screening methods. According to Lang and contributors, the Hispanic or Latino population is disproportionately affected by tuberculosis. Incidence of TB is highest among Latino and Asian immigrants. In fact, these populations are 9.5 times more at risk than Americans born in the U.S. A study in 1986 by Paris Sable found that immigrants may have already contracted TB from their country of origin. At the time, significant reactions for TB were found in 53% of immigrants, while only in 7% of Americans. In 2015, the CDC stated that 25% of people with tuberculosis were Hispanic or Latino. Per Campbell and contributors, new immigrants require targeted screening for tuberculosis and treatment for latent tuberculosis. This graph by the CDC shows reported cases of tuberculosis by origin and race and ethnicity. We can see that Hispanics or Latinos and Asian are among the most affected foreign-born persons with tuberculosis. The structural constructivist model best explains disparity of tuberculosis among Hispanics or Latinos. Barriers to treatment and screening are described as cultural, linguistic, and financial by Lang and contributors. According to Jones-Nielsen and contributors, language, in addition to lived experiences, beliefs, and values, continue to be the biggest barriers to patient treatment adherence and have been associated with poor health outcomes in this group. Other barriers, as noted by Allinger and contributors, include sociocultural factors that tie to access to transportation and clinic hours meeting needs and availability of the patients. The CDC lists limited access to care, unemployment, and housing as further sociocultural contributors. The determinants that can be adjusted are as follows. Health and healthcare. Latino patients are less likely to adhere to medication regimen if healthcare providers don't speak the same language as them. Social and community context. Per Rita and contributors, cultural interference increased adherence to latent tuberculosis intervention therapy among Latino immigrants. Education. A study by Howell and contributors indicates that Latino adolescents who were coached increased their adherence to treatment for latent tuberculosis infection. In sum, tuberculosis is still a relevant health concern today. Hispanics and Latinos are disproportionately affected because of language barriers, sociocultural factors, and poor adherence to treatment. Methods to reduce the incidence of tuberculosis among immigrants need to be culturally relevant as well as presented in a language that is understood. Increasing studies show that cultural sensitivity is effective in creating a relationship between provider and patient, bridging this gap. There is further evidence that supports new ways ultimately will benefit all Americans by reducing the risk of tuberculosis, both active and latent.